Hey guys, I'm Justin Myers, Director of Programs here at Show Hope. One thing that I love about my role here is that I get to journey with families through their adoptions. Many children who have been orphaned live with medical care needs, with limited access to adequate health resources. And once home, rising medical costs and access to treatment can be overwhelming for families. However, there are helpful medical care resources available to families, both pre- and post-adoption. The Bureau of Consular Affairs in the U.S. Department of State provides a wide spectrum of practical, helpful resources and considerations for families, both pre- and post-adoption, including considerations related to medical care. Housed within the U.S. Department of Health and Human Services, the Children's Bureau provides the Child Welfare Information Gateway, a service that offers myriad tools and help for parents on the adoption journey, including medical and healthcare information. The Centers for Disease Control and Prevention, also known as the CDC, provides information on international travel, overseas care processes, and healthcare providers here in the U.S. The CDC is another helpful resource for parents and families impacted by adoption, specifically related to medical care and children who have been orphaned. The National Organization for Rare Diseases, also known as NORD, is a patient advocacy organization dedicated to individuals with rare diseases and the organizations that serve them. NORD provides information about rare diseases, patient organizations, and other resources. They also promote awareness of rare diseases among physicians and other medical professionals. In addition to these national organizations, there are children's hospitals and nonprofit clinics around the nation that specialize in pre- and post-adoption care. Just to name a couple, there are the Adoption Medicine Clinic at the University of Minnesota and the International Adoption Services provided by the Children's Hospital at Vanderbilt University right here in Nashville. There's also the Adoption and Foster Care Clinic that's based in Birmingham, Alabama. While this in no way is an exhaustive list, it could be a good starting point for you. These organizations, and many others like them, are helpful for families both pre- and post-adoption. We encourage you to work with your chosen adoption agency, which should be able to provide you with helpful information and more detailed knowledge of your child's past and present medical needs. At Show Hope, we know the adoption journey does not end the day a child is welcomed home. In fact, the journey in many ways is just beginning. With that in mind, our founders, Mary Beth and Stephen Curtis Chapman, have cast a vision to dig deeper with children and families impacted by adoption and foster care. Out of that desire, Show Hope's newest initiative took shape. Show Hope now offers medical care grants to financially assist families who have adopted children experiencing healthcare needs, whether those needs are pre-existing or develop later on in a child's life, up until age 18. Knowing these financial resources are available to help offset expenses related to caring for a child's complex medical needs, it is our hope that families will feel more confident in their ability to provide for a child after welcoming them home through adoption. If you'd like to learn more about medical care grants, I encourage you to visit showhope.org/medical care. Thank you all, and I hope you have a great day.